It's quiet so that we can start the.
Mr. Chairman, sir, distinguished ladies and gentlemen, my fellow colleagues, students, it gives me great pleasure to stand before you here to discuss this very important topic, restoring confidence in the Nigerian healthcare delivery system, essentials of effective health record service. Mr. Chairman, sir, permit me to start my presentation with a story. I want to share this story with all of us so that we'll have a grasp of the state of the Nigerian health system. This is Sunusi Lamidu Sunusi, who is the former emir of Kano. He was popularly known as Muhammadu Sunusi II, and he cried. Sunusi cried while he was sharing an experience, telling a story of a lady that lost her child while she was waiting for him in his own palace then in 2019 to seek for financial assistance to take her own child to the hospital to receive care. In the process of waiting for her own turn to see the emir, she couldn't help but watch her own son die in her own hands. This is a sad story, and this is the story of our health system in Nigeria. Over the time, we've lost confidence in the health system because the system has failed us. People watch, they can't do anything about their loved ones because of a reason or the other. Mr. Chairman, this is not the only story. I have another story. This is the popular Professor Halima Idris. Halima Idris was a former Commissioner of Education in Katsina State. She was also a former Dean in Faculty of Sciences, Umar Musa Adwa University, Katsina, and she died. She died on her way to Abuja from Kaduna. She was a victim of banditry. She sustained gun injury, and she couldn't gain medical assistance in the nearby facility. Of course, she died. And because of so many issues, which I tried to highlight some of them, there were issues of non-availability of immediate ambulance services in our own health system. Unskilled human resource for help. We have quacks all over the place, manning our facilities and killing people whose time is not even yet for them to go. We have stock out of essential drugs in our own facilities. We have so many problems with bureaucratic issues, especially across the security decisions when it comes to emergency care and services. So in simple terms, the goal, the purpose, the vision of the healthcare delivery service has failed all of us. And this is a classical failure and loss of confidence in the healthcare service delivery system. I know all of us have one story or two to tell with regards to the healthcare service delivery. We must have seen or heard or know one person or the other who has suffered the problem in the healthcare service delivery because of the issues that are peculiar to the Nigerian healthcare sector. I lost my mother to maternal mortality. I lost my father to kidney disease in our own facilities, one of the best and the most enviable facilities in the country, but they still died. So these are not the only stories. There are so many stories that will continue to share. Patients complaining of missing cats. They go to facilities, their cats are missing. They cannot find it. Sometimes not only the cats, the case folder completely is lost. All results of investigations are missing either at the record or other units of the facilities. They often have to make additional payment, despite the fact that they've paid for those services. They will be forced to pay for additional monies for those services, which on a very good day they've already paid for. And because of that, some are even harassed or embarrassed. No explanation, no apology for the reason of the missing of their records in our facilities. This over the time has caused untold hardship. So many people have suffered, so many people have been embarrassed, so many people had one form of disappointment or the other. And this over the time has resulted in outright termination of medical care or even postponement of those services that on a very good day they would have received in those facilities. At the same time, long queues in our facilities. You go to the card room, you spend the whole day. In fact, people now assume that when they are going to a hospital, it's a day event. They spend the whole day cancelling their appointment, preventing them from going to their places of work or their marketplaces. Patients wait long hours only to be told at the 11th hour that they cannot be seen because their records are not available, their cards are missing, or their folders are not there. Just yesterday, I saw a patient in Yakawada, one of our comprehensive healthcare centers. She had 4 temporary folders. Whenever she comes to the clinic, they will tell her file is missing. They'll have to open a temporary folder for her. They open it, subsequently she come back, they say the folder is still missing. They will give another one. She had 4 temporary folders. Drug treatment are given without even seeing the result because the results are missing, they cannot be seen. Procedures, surgical interventions are delayed, they are suspended, they are outrightly cancelled because case notes or folders cannot be found. Over time, record of confirmed working diagnosis are lost. There is a patient I'm seeing, I don't even know what I'm managing her for because I can't find the previous folder which carried her diagnosis and which carried the previous training that has received. This has resulted in deaths. So many people have died because of negligent absence or lost case folders or records of those clients or patients. At the same time, those that are able to survive, they leave the hospital with one form of complication, disability, treatment failure, or even loss of resources. They've paid so much, but they've not gotten what they are there to receive. And this is a dent on the medical service and the healthcare service delivery in the country. Additionally, lack or absence of good health records has worsened the case scenario, causing medical errors. So many times, because of a missing record, doctors or attending physicians come up with wrong diagnosis, which give rise to poor patient attendance, and because of that, patients have lost satisfaction with the healthcare service delivery. And we will all not wonder why some of us have to leave the shores of the country to seek for simple investigation outside the shores of the country. This has given rise to malpractice because once cards are missing, information cannot be found, malpractice thrives. People cook or synthesize data and information to hide their negligence or their incompetencies. So, having looked at this as a preamble, let's quickly look at healthcare delivery system. What is even healthcare delivery system? A healthcare delivery system is that mechanism, is that process, is that procedure that is put in place to provide or to meet the health needs of me and you as individuals. These services include primary, secondary, tertiary services, and they vary in complexity, they vary in their nature, they vary in their types, depending on the level of care one seeks. Also depending on the expertise we have, depending on the nature and the type of illness, the nature of the patient, and at the same time, the settings where those services are being provided. The trend of service provision is toward holistic approach. If you are providing service, we are looking at it holistically, all-encompassing, ever-flowing. We look at it from the physical, the social, the mental, the intellectual, the spiritual, as well as other components of health. Health system has its own goal. What is that goal of the health system? The main goal of healthcare service delivery is the provision of efficient services that enhance health and prolong the life of our patients. But is that what we have as a country? Services that prolong our life, that improve our own quality? You all agree with me that this is not what we have in our own country. And to also buttress on that fact, to achieve this goal, the patients must be able to get the appropriate care. So many times patients visit hospitals, when they come back they are more confused because they don't even know what is wrong with them. On a very good day, what they have thought was their problem is no more the problem, and the workers have not even taken time to explain to them what is wrong with them. So for the healthcare workers to even deliver on their own activities, to do their own work, the healthcare providers require the presence of accurate, consistent, complete, timely, and reliable health information. There is this popular Hausa proverb where Noma say the Katanya ho, Asibiti say the Kati. That is the underlying condition. No matter the competency, no matter the capacity, no matter the experience, no matter the qualification of the attending physicians, you must see your card, your data, your information, the records, before he or she will be able to help or assist you as a client or as a patient. Health records, therefore, are the compilation of the patient's pertinent facts about the patient, their life history, their presentations, the manifestation of the disease, the diagnosis, the treatment options and modalities, as well as the services he or she receives from the facility. They must contain sufficient information to identify the patient. So many times you see records, with those records you cannot even trace the patient. Either the name contains a lot of abbreviations, or the age is different or inappropriately written. Example, instead of writing adult, instead of writing 18 years, you are writing adult. Every other person is an adult. So how can you be able to identify with certainty that this adult is referring to me or is referring to you? Health record also should consist of written account of the patient's examination. As an attending physician, what have you done to the patient in terms of examination, in terms of the treatment, in terms of the investigation, their results, and even the justification for providing those results. Health record service, therefore, are the sum total of all activities that are involved in the control as well as the governing processes of important data and information of either a client or a patient, health facility, health system, health institution, as well as related sectors that are associated with self-service delivery in a comprehensive manner that will assist us in taking decision or reaching a conclusion. If data is not made available, medical records are not made available, attending physician cannot conclude. And when I talk of conclusion here, I mean making a diagnosis. He cannot decide on what modality of treatment to provide and how to go about it. So the process involves identifying, classifying, prioritizing, storing, securing, archiving, preserving, retrieving, tracking, and ultimately destroying those records that are not relevant. So many times you go to look for a patient's record who is due for orthopedic case and you find it in family planning section. Or a pregnant woman coming to seek for her card, you will see it in what? Child welfare. Or a child card, you will see it in psychiatric records. So these are some of the issues when it comes to identification and classification. With regards to prioritizing, there are clients or patients that visit the hospital regularly because of a chronic health condition which requires immediate or emergency response and assistance. Example, asthmatic patients. Such patients, their records should be placed or prioritized where it can be retrieved in good time. But we spend the whole day looking for their records or looking for their cards. So these are some of the issues. Also, when we look at the goals of the health record service, we will notice that among other purposes of health record service, the main goal of that service is the continuous supply as well as sharing of quality data that is needed in the health sector for management and decision. But unfortunately, most of the data we see today in terms of health records is just junk. People salad the information and you cannot make a meaningful contribution or meaningful decision out of it. And this means that we need to get the right data, we need to get the data right, we need to get the data right away, we need to get the data the right way, and at the same time we need to get the right data management. I hope I've not confused any of us. When we say getting the right data, we mean all the relevant information as expected of you to get from a client or a patient should be obtained in terms of his age, his or her age, the gender or sex as the case may be, the tribe, the religion, the occupations, other socioeconomic status. But several times we see missing blank spaces on the cards. Somebody is in a hurry, he or she is not patient enough to fill in those blank spaces. And at the same time, getting the data right is like the other example I cited earlier. Instead of writing the age in years, you are writing adult. You've gotten the information, but gotten it the wrong way. Then getting it right away. Don't say, no, get it now that you have the opportunity. Because that may be the only time you are going to see that client or that patient. The moment he leaves where you are is a missed opportunity. then getting the right data management. It's not enough to get the information of what benefit is the data to you, how do you manage it, how do you come up with something that is meaningful to make decision or arrive at a conclusion. So when we talk of relevant information, this is what we are talking about. At the same time, effective health record service empowers the medical practitioners and also protects their patients. When I talk of empowering the medical practitioners, it's when you are giving information that you are empowered. I remember here having recited the professional anthem, Mr. Saka mentioned something. Can any of you remember that statement he made? He said, information is power. It's when you provide information to the health worker that you empower him. But the moment the health worker has no information, is just somebody sitting somewhere and doing nothing. Do you understand? It's when you have information that you are empowered. Once you lack information, you are just warming seats. Health record services are the basis for policy and decision making at various levels of the health sector. The CMD this morning we learned had a meeting with all head of departments. This is because of information you want to pass. And that information that he or she is passing will enable the departmental heads to take a decision, to come up with a protocol, or even change their procedures of doing things. So information, even at the level of our facilities, assists us in coming up with policy, coming up with decisions, and modifying our processes and procedures. So also accurate, appropriate, precise, timely, valid, and suitable health record service is required for decision making in various levels of healthcare service delivery. At the same time, adequate health record service enable healthcare providers to reconstruct the essential part of each patient's information without reference to our memory. There are times you see patients, but because the required information is not there, you start doing game of chance with somebody's life. It's either this or that. Baba, you said the other time you came, they gave you this. Can I see it? I cannot see it. Okay, let's just assume it's this. So you are playing with somebody's life, and because of that, so many people have lost their lives, or they've suffered one form of complication or the other. These are some importance of our health record services in our healthcare facilities. Healthcare facilities or institutions, we all know, we are all aware, they generate the information, they receive and preserve the records as part of their functions, activities, and their mandates. Health records serve as an important source also of information. It's when you have the record that is required that you have the information, either at individual, at unit, at department, or even at facility level. Also, health record service is considered as an integral component of health institution, which is used to facilitate the achievement of their routine objective. Every person you see in a health facility have an objective or a goal or a function he is or she is there to achieve. And if information is not there, that individual or those group of individuals cannot achieve their functions or their routine objectives. Health record staff play vital roles. So I'm going to tell you here today, you are the most important component of the hospital system. At the same time, we are the eyes, we are the windows, we are the face of the facility. People start judging a hospital by meeting us or coming in contact with us. If you paint a bad picture of the system, people will continue to go with that belief of the system of the facility. So we are the most important staff and we play a critical role in the delivery of healthcare service delivery. They apply the science of informatics to the collection, the storage, the use, and the transmission of information. They are also responsible for improving the quality of healthcare. It's when you provide a qualitative data, that qualitative information can come out of it, and decisions can be taken, and people will come out successful or responsive to care when they visit facility. And at the same time, they manage as well as construct the health information services to guarantee that they accommodate medical, legal, ethical standards and frameworks. What this is trying to tell us is information that we provide in terms of medical records is not only required within the medical milieu or environment, it serves as a legal document that can be tendered in a court of competent jurisdiction. I remember I shared a story with my students one time. I said I had a court case, 2007 or thereabout. I was in Bauchi, and I had a court case. A husband was claiming 60 million damages because he lost his wife that we managed. It was the record and the information that saved me. I put dates and I put time, and that was the saving grace. This is to tell you that that information that you are putting down or refusing to put can put somebody's life on the string. It's a legal document, not only a medical document. At the same time, our profession is built or not on ethics. It's also an ethical document, in the sense that it's when information or data is available that will be able to say that ethical procedures or processes are observed. The concept of beneficence, the concept of non-maleficence, the concept of autonomy, the concept of justice are enshrined when record is kept, and people can be able to access that record and make comparison with best practices across the globe. It is often said that effective health record service indicate adequate patient care. Poor health records indicate poor patient care. You can't deny these facts. The moment you start seeing poor records, if you are accessing a facility, if you live here and want to access a facility, just look at their record. Poor record keeping is an indicator of what? Poor patient care. This may not always be true. There are times that patients receive the best of care, but they are poorly documented. Or they are fully documented, but they receive worst of case. But in most cases, the moment you see a poor record keeping, you can swear that that patient received worst of all case while staying in that facility. So as I mentioned earlier, we are the window of the facility, and what we are able to do can be used to judge the facility and other members of that facility. So how can improving the effective health record service in our own facility or in our own nation bring about increase in the confidence in the healthcare service delivery? This is the meat of our discussion. We are talking about how to improve client or patient confidence in the Nigerian healthcare service through what? Through effective health record services. One, we can do that by improving patient safety. And patient safety can only be improved when health workers get access to patients' data with the help of health information system. And they get acquainted with those patients, get their information, and also share information with other members of the medical team. As a doctor, when I get the information, I can share it with a nurse who is also a part of the team when it comes to patient care. She can also share it with the pharmacy, who can share it with the laboratorian, who can share it with the physiotherapist. And when wrong information is passed, all these 5 people that I've mentioned, they get wrong information, and that ultimately affects the patient safety or the client's safety. So in this way, we can avoid committing what? Serious mistakes. When we have appropriate and adequate information, we'll be able to avoid serious mistakes, and this will go a long way in boosting the patient's confidence as well as his trust in the Nigerian healthcare system. That is one. The second point is improving the patient care. I told us Noma say the Patanya, Asibiti say the Kati. It's when you have the information that will be able to attend to the patient, and when you attend to the patient, you'll be able to come up with information with regards to what? The diagnosis, the medical history, the allergy the patient suffers, plans you intend to execute in managing the patient, investigation results, and what have you. And better patient care means improved patient satisfaction. You cannot get this without information. And this translates to patient confidence as well as trust in the system. Another point is establishing hassle-free process of performance analysis. Anything that is documented can be assessed. Anything that is not documented cannot be assessed. A classical example is tests. Once tests are given, we ask you to write, and marking scheme is made available, and people mark and grade. If those information are not provided, marking scheme is not made available, we cannot mark and we cannot assess. So also the health system. If information is not recorded, nobody can ask for it and nobody can assess it and see whether things are done according to plan. So using health record service enable multiple avenues through which health facilities can assess the staff's performance. We see whether the doctors are doing the right thing, the pharmacists are doing the right thing, the nurses are doing the right thing, and check the efficiency as well as the stability of the facility. At the same time, this also enables the patient to get the chance of sharing their experience with regards to the level of care they receive within a facility, and by doing so, they gain satisfaction, build confidence with the Nigerian healthcare system. It also goes a long way in ensuring excellent healthcare service provision to patients. Once information is available, is readily accessible, and is pertinent or relevant, health workers can access the patient's situation, make requirements, and also seek for their desires. And by doing so, they can address the kind of situation the patient or group of patients find themselves. And careful attention to this helps the health workers spot the areas where they can improve on the patient care or management. Another point is overcoming medical error. The Nigerian health system is characterized by a lot of medical errors. So many times patients leave the hospital and tells you the doctor he has met today just told him he's not diabetic or he's not hypertensive, and he has been taking medication for God donkey years. So it's when appropriate, adequate, and relevant information is made available that individuals can be able to access the details of things and will be able to see whether there are errors and overcome those errors. And when patients know that whatever you tell him is the truth, he has or he builds confidence with the system. Ensuring instant and seamless access to patient details. It's not enough to get the data, but are you sharing it with other relevant stakeholders? Sometimes because of our incompetency or because of our carelessness or neglect, we collect the data, but we are afraid to share the information. Let me share an experience with us. The ABUTH Teaching Hospital is coding for causes of death in the facility for the last 10 years. I'm part of the team that are saddled with the responsibility of collecting the data and coding it using the ICD-10. But several times when we go to collect folder from where it is kept, people hoard that information. I'm not saying we are angels. Some of the problem is from our own side as attending physicians. We've collected so many folders, we are yet to return them, and they also need them for their own records. But most at times they hold that information because there are many things that are found wanting in those records that they don't want to divulge, or they don't want to let it out so that people will not find their faults or their problems. So ensuring seamless access to patient data will boost the confidence of those patients with our healthcare service delivery. At the same time, minimizing operational expenses. It's not enough to say we've reduced problems, but at what cost? So effective health record system enables health organizers to assign resources in a planned manner. It's when you have information as a facility or as a healthcare delivery system, irrespective of the size of the system, that you'll be able to allocate monies or budget for it. But once information is not there, data will not be available, and you cannot budget adequately or appropriately. Saving time, improved data can save time. So many people, I told you, will spend the whole day in the hospital waiting to see doctors. Only at the 11th hour they will tell him, Baba has spent the whole day waiting for a doctor. Unknown to him, his card has not even been isolated. So when patients are aware that time will be saved, they will be eager to go to the facility. In Shika, so many patients want to go to staff clinic rather to go to the GOPD because they know their cards are secured and they will be seen in good time. So you see, time is equally important. Improving patient satisfaction will go a long way also in boosting the confidence of the patients and their trust in the system. And last but not the least, ensuring the privacy and confidentiality. While we were singing the anthem, I remember the person that sang it was mentioning something about confidentiality. You remember? Confidentiality is our what? It's our watchword. So the moment patient knows his confidentiality is not secured, I bet my next month's salary to not come to that facility. Yes. So health records can include some of the most intimate details about our own personal lives. Information that we cannot tell our parents, we tell the facility. They document patient physical and mental health, can include information on our social behaviors, personal relationship, even our financial status. Hence, is a major concern for the patients and for the clients. And once this information is not secured, confidentiality issues are not engraved, patients lose confidence with the system. But conversely, if they are ensured, patients have confidence in the health system, they trust the health system, and they patronize the health system. In conclusion, patients and their relatives over the time have suffered great disappointment, complications, and even death in the process of healthcare seeking in Nigeria. This over the time has resulted in reduced patient satisfaction and loss of trust and confidence in the Nigerian health system. Health record service is an important game changer that is capable of improving the quality of healthcare by ensuring that the best information is available for making any meaningful health care decision and change within the health system. Despite so many difficulties and challenges facing the healthcare sector, maintaining and improving the health record system ultimately have a profound effect on healthcare service delivery. And this is because health record is the central point of clinical decision making, as well as physicians and healthcare service facilities cannot function without health information. And if properly harnessed, this will go a long way in restoring, maintaining, and promoting trust and confidence of patients in the healthcare system delivery. And this is what we all intend to achieve within the Nigerian healthcare delivery system. As a recommendation, there is need to institute clinical documentation improvement programs and promote quality clinical documentation among all healthcare providers. So it's not enough to say we have medical records. Come and train other people. I was telling my students the other time, when it comes to data, when it comes to information, when it comes to statistics, you should be better than so many of us, because 90% of what you do depends on data and data sharing. Unless if you want to start one cement shop after school. If you want to remain a professional, you must be conversant with data, information, statistics, and what have you. At the same time, there is need for the observance of good health records practice by all stakeholders that are involved in medical records. There is also the need to sensitize all stakeholders on the subject and to introduce reward system for good health records practice. There is also the need for the review of our training curriculum or curricula, as the case may be, especially with introduction of relevant as well as user-friendly softwares and other applications that we can use in our own profession. In addition, health information managers require continuing medical education or professional education, especially on health information technology and government intervention in the provision of infrastructure in order to put into practice computerized health information system. Please, if there is one point you must take home at the end of this presentation, is this slide. Everybody should look up. If there is one slide that you want to take home, this is the slide. Always remember that quality data give rise to quality information. Quality information brings about informed decision making. Informed decision making improves health service delivery. And improved health service delivery improves patient response to the medical treatment and outcome. And once this is improved, it improves patient safety and satisfaction. And once the safety and the satisfaction of the patient is improved, it restores his or her confidence as well as trust in the healthcare system or service delivery. This is the end of my story. Thank you for your time and thank you for your patience. These are some of my references. Thank you very much.
Another of our person, no any other person, but Madam Aisha, you are highly welcome to you and the guys are present. Permit me to share with you this short story regarding the lecture that was delivered, for you to know that truly information is power. I remember something when when my uncle insists I must go back to school to go and do medicine, for good 2 years I was running away. I don't want to see him because there was a day my mother just told me, you can't continue running away. Just tell him this is what you want to do. So I met him and I said, sir, please, it's not because I don't want to do it, but I'm not interested. I find pleasure in this profession. So after school, I went to him that, sir, I want to give back to you to tell you that I didn't waste my time. I will run a clinic with you for just a day. So what I did is, on that day, I was the one on duty, get all the folder, once the patient come, I will retrieve it, I will make just short history of the past treatment, the details, because it's a family medicine hospital. I will say, sir, when any of your patients enter, look at these things. Ask about this so person, this so because they are using family folder. I said it will give your patient joy that truly you know him or her. Just try these things and look at the history of what you've done. So when your patient enter, please, I want you to make use of this. So we tried that on that day. So at the end of the day, he said, I will have regrets or I will have blamed myself if I insist he must do medicine. Truly, you made me proud. Seriously, if you can do it well, health information is the best for you. Thank you so much. I believe you all gained a lot, but I will just remind you that there was a question that was raised during the course of the discussion. It said, is the goal of healthcare system achieved? Is it achieved? It's not, and we all know why. Because during the course of discussion, you see the reason why those goals are not achieved. And also, there was a question that asked, is the goal of health information officer service achieved? To some extent, no, and we all know why. So if those goals can be achieved, that means we are going to restore confidence in the healthcare system. So thank you so much. So if there is any question, we are going to attend to few questions. Please, if you have any question. Okay. 1, 2, then 3, 4. All right. Number 1, please.
Thank you, sir, for this your wonderful presentation. I will say that the presentation is wonderful, insightful, and it's even when the heart of the audience. It's really educating. So thank you very much for that. And from your presentation, we discovered that health information management is the key, is the beginning, and it's also the end. So almost, if I may quote, I would say 80% of the work in the health facility lie on the health information. This shows us that the change will start with me. So as health information management students that we are here, with your presentation, we get to know our work more and more better. And we think that we have to change ourselves before we can change the health facility. So sir, my question goes this way. What if we, as the health information practitioners, we are ready maybe to deliver to the fullest, but maybe we may need some necessary materials or equipment to deliver, but those materials are not provided to us. In that case, and because of lack of those materials, maybe we cannot deliver to the expectation. What do we do?
We should make our question brief because of time. We still have a lot of things. Please. So number 2.
So, sir, my question is in education, there is a recommended percent of error which should be accepted, but I don't know whether in health line we have that. I think that in the education sector it is 0.0%. That is a 95% of all the data related to that education sector must be true. What about this in this sector, that is health line, that we are dealing with the human life? Thank you very much.
My question goes this way. What if the health information were able to do their own part very well, and because at the course of the presentation you didn't talk much on the physicians, you find out that health information will do their own part very well. Is there a possibility that we have errors regarding other health professionals? If yes, in which way?
I as a person going to be one of the medical health record officer. So I really want to ask, you talked about getting the right data. That's where I want to ask. My question is, I was opportunity to be in psychiatry hospital after my 2, and we noticed that most of the person that comes to the hospital will have their relative behind, and their relative will not be necessarily the people who will give the right information about them. And owing to the fact that they are mentally disturbed, we cannot get the right information from them. In that case, what do we do?
Instruments and tools, such of roles and responsibilities as health managers. Yes, it's equally important, but I want you to know that Rome was not built in a day. Nobody will just come and hold you and give you instrument and equipment until you prove your own worth. Even in the facility, let me use teaching hospital as an example, is when you prove your worth as a department or and tools, such of roles and responsibilities as health managers. Yes, it's equally important, but I want you to know that Rome was not built in a day. Nobody will just come and hold you and give you instrument and equipment until you prove your own worth. Even in the facility, let me use teaching hospital as an example, is when you prove your worth as a department or as an individual and are able to do the right thing, deliver on your goals, and get money for the facility, that the facility pays you back. So if you want to wait for instruments and equipment to be made to you without delivering on what is expected of you, then you are just deceiving yourself. Prove yourself, let people know the relevance of the profession, and before you realize, people will come in and start supporting you necessary instruments and equipment. The act with regards to margin of error in education is 95% confidence interval at alpha level of significance of 0.05, which is 5%. Even in the health sector, it's like that. But it depends on the nature of the ill health or the disease. If, for example, in the discovery of drugs, you are looking at something that life and death depends on it, you can reduce the margin of error from 5% to maybe 1%. So you increase the confidence interval to maybe 95% confidence interval, at the same time reducing the alpha level of significance to just 0.01. While if it is something that may not necessarily affect life and death, you may leave it at 95%. In fact, other times you can drop it to 90% confidence interval. So it depends actually, but not only in education, across life itself. That's why even in statistics you have the uniform distribution with 95% of all the population within how many standard of deviation? Within 2 standard of deviation actually. The third question, he asks, what happens if we as health managers are able to do our own and the other sections, all the other components, all the other units in the hospital have failed? Don't say you don't do what is expected of you because others are not doing. It's like you not reading because your neighbor is not reading. You are doing a great disservice to yourself. Continue to do what you are trained to do and do it to the best of your ability, and time will vindicate you. So please don't relent on your efforts. or with the belief that the attending physicians, other health workers may be found wanting. So because of that, I will not even collect the right that please collect it. I told us in our presentation, and information, life may depend on that information. Or it can be a legal document that information, once it is provided, is going to save the neck of somebody. So you see, health information management does not only save our own profession as attending physicians or doctors, it also saves our necks. Because the moment we are found wanting, in their legal case, ultimately we fall back to the record. And as a doctor, they will baptize you if you don't have the required information. No evidence, no case in law. The fourth person is talking about the right data and insisting on getting data from the right source. He cited example with psychiatric clients or patients that they cannot provide the right or the relevant information, and most of the time they come with a caregiver or a relative. If that caregiver cannot help you, insist on getting the information from the right source. You remember the 5 rights: the right data, getting it right, getting it from the right source, getting the right data management. So please always insist you want to get the information from the right individual. Don't say because we cannot get it, let's make do with what is available. No, insist. Baba, tunda ba ka yi fada mana ba, ka kira wata mana ba mama na waje ba, ta go ta fada mana information with regards to our patients. Do you understand? So always insist on getting the right information from the right source at the right time. Thank you.
This is another side. Let me introduce to you the representative of lab scientist. I will be one of the discussants for today's the sub-team of the program. Is representing the JCF chairman, who is to serve as the representative of medical laboratory scientist. Permit me to introduce you, Bala. You are highly welcome. Without wasting much of our time, please move to the second lecture. And the person that will present it to us